So, John, I caught up with you in about mid-May. We were 111 kilograms and we had a lot of back pain. We also had some altered sensation in the lower limbs, like pins and needles and all that kind of stuff, that wasn't easily explained by, spinal cord problems. And we talked about your weight in our consultation. Now, what was the main thing you got from our talks about nutrition and healthy eating?
Well, the main thing that I got was I had to lose weight.
Mm-hmm.
You talked about metabolic syndrome, and I knew my blood pressure was high.
Yep.
I also knew that I had a high blood sugar level. So I've already known that from the GP, so I decided to do something about it.
Yep.
And bring down the blood sugar level and the weight.
And what was your typical morning breakfast, 3 or 4 months ago?
Would be Weet-Bix or something like that.
Yep.
Possibly bacon and eggs, possibly porridge or something like that.
Yep. Did you have toast and things like that?
Quite a lot of carbohydrates.
Yeah. Okay,
now,
so
probably at the moment either skip breakfast altogether, which is probably a healthy thing, but sometimes I don't feel that hungry.
Yeah.
Or I'd have some eggs. This morning I had a couple of small pieces of fruit and a little bit of steak.
Now, when you have your fruit, you have real, like a piece of fruit, not like fruit salad or...
No. That's Chinese gooseberries or kiwi fruit this morning.
Yeah, so fairly low sugar fruit as well, eh? Not mangoes and pawpaw and watermelon.
Well, I did have a bit of pawpaw.
A bit of pawpaw. But a lot more sort of bacon and eggs type of brekkie, protein and healthy fat.
Yeah.
And tell us, sorry?
Normally, that was abnormal for breakfast for me. Normally, if I was having breakfast, it would be something like an omelette or bacon and eggs or something like that.
Sensational.
I'll skip breakfast altogether.
That's what I had for That's what I had for brekkie this morning.
Sorry?
That's what I had for brekkie this morning, bacon and eggs. And so what then did you start to notice? Were you losing... How quickly did you start losing weight? Did you start noticing the weight coming off?
I lost weight very rapidly at the start. It dropped down 5 or 6 kilos in the first 2 weeks.
Yes.
After that, it slowed, and it seems to be going a little bit in spurts now. Like it's... I thought it had stopped a couple of days ago, and then this morning I weighed myself and I dropped another kilo. So it's sort of, it's not consistently steady.
Yep.
It's sort of like a little bit lumpy at the moment.
Yep. And tell us, so we've approximately 15 kilograms weight loss in 3 months, which is when I first saw John. And what has that done for your back pain? You said you still got some pain, but it's different.
What I'd say with my back pain is that I haven't got constant pain, but I have got soreness.
Mm-hmm.
It is weak because I can't lift anything heavy. It sort of sets it off a bit.
Yep.
Tried to play 1 round of golf. I played 9 holes.
Yep.
Sort of upset me for a couple of days. I was going to ask you about that. I should be going back to play golf again.
Well, there's a few other things we've got to do now to start strength. Do you find that you've got a bit more energy? Like... are you a bit more energetic?
The jury's out on that.
Did you play golf before? Were you out there playing golf before I saw you? Like, or was that on the back burner? Was that on hold?
I didn't play golf for a long time because of the back pain.
Yeah, so you stopped playing golf.
Now I'm not too sure about whether I can play or not.
Yeah, we know that people who sort of get rid of their hyperinsulinemia, a lot of them do describe having more energy. But
energy's not too bad. Although, if I start doing something, I can be quite dedicated about it.
Yes.
But the issue is to actually get started.
Yes.
And I think probably do. I could probably do with a bit more energy, really, than I've got at the moment. That's probably part of it. From my reading, that's partly to do with the diet.
Yeah. Well, we're going to refine that a little bit too. And what about the tingling in your lower limbs? Any ongoing? Has that changed? The tingling in the legs?
The legs are not too bad at the moment. I'm not quite sure how far I could walk.
Yeah.
When I came to see you, and for a while there afterwards, I would say I'd be flat out walking a kilometre.
Yeah.
Because I'd get half a kilometre away, and then it'd be difficult to walk home.
Yeah.
But now I think I could probably walk a kilometre away and a kilometre home without too much trouble.
Yeah.
So I'm not quite sure. I haven't really tested myself about how far I can walk.
Okay.
But on the treadmill, I'm not doing too badly at gym.
Right.
So,
Okay.
I don't feel I can't walk at the moment.
Well, things are heading in the right direction anyway. It's certainly better this time than last time, your overall presentation. And you haven't had to take, potent painkillers or drugs. You haven't had to have surgery, and you've done it purely by improving the way you eat. Thanks, John. Thanks, John, for that. And this is John's MRI. You can see the normal spinal canal here. You can see moderate stenosis on this scan slice here. And we may still need to operate on that, but if we do need to operate on John, he's going to be a far safer patient to operate on than being floridly insulin resistant with metabolic syndrome and central adiposity. And you can see here still the retroperitoneal fat that is part of that central adiposity syndrome, with the blood vessels encased in fat, and this fat layer should not be there in health, or is not there in health. You can see all that white is fatty tissue. And this is the side view, or the sagittal views of the spine. And you can see here fat building up within the spinal canal. And technically we wouldn't refer to it as visceral fat, but I believe this is a consequence of insulin resistance as well, with the accumulation of epidural lipomatosis, and again in the retroperitoneal space of the abdomen. This is all fatty tissue that's not present in healthy subjects.